Thank you for joining us and welcome to the CONVERGE Summit. I am Maurice McCants-Pearsall, the Director of HIV and Health Equity at the Human Rights Campaign. Through our programming with Gilead Sciences, our community partners will play a vital role in helping us move the needle closer towards ending the HIV epidemic. During this session, titled It Takes a Village, we will explore the impact and the role of minority-led and serving community-based organizations as they move forward to ending the HIV epidemic. Today, we have assembled a dynamic panel of nationally renowned HIV advocates and leaders. These leaders are on the front line of ending the HIV epidemic, particularly in the Black and Latinx community. First, we have Arianna Lint, the CEO and founder of Arianna Center, one of Florida's leading trans-led and founded organizations. Arianna uses an integrated case management model to address the needs of women of trans experience, undocumented immigrants, and sex workers, while providing access to HIV prevention and care services in South Florida and San Juan, Puerto Rico. Welcome, Arianna. Next, we have Cedric Sturdevant, Executive Director of Community Health PIER in Greenville, Mississippi. Community Health PIER is a newer organization who seeks to improve the overall health outcomes of low-income communities through addressing obesity and the spread of HIV and STIs in rural Mississippi. Cedric, we welcome you. And our next panelist really needs no introduction. Gabriel Maldonado is the founder and the CEO of TruEvolution, based in Riverside, California. TruEvolution is instrumental in the fight to advance the quality of life, for LGBTQ people. And he does this through access to HIV prevention and care services, a robust housing program, and behavioral health clinical support services. Welcome, Gabriel. So panelists, welcome again. Thank you for joining us today. And without further ado, I would toss our first question to Arianna Lint. So Arianna, we have this conversation all the time. Why is it that minority-led and serving community-based organizations are so important in the fight to end the HIV epidemic?
Well, I think as a transgender woman, openly living with HIV and serving the most marginalized community in the HIV field, I personally think you cannot stop the HIV if you don't touch or you don't connecting with those marginalized communities. We never touched by outreach, conventional outreach programs or different other things. It's other type of community. They are never touched. They don't have information. And that's why my organization, acting like a bridge to those organizations and linkage to different programs available in the community.
Thank you for that. I asked that same question of Cedric. Cedric, why is it that community-based or these minority-led CBOs are important in the fight to ending the epidemic, particularly in your area?
Well, in my area, I'm in the rural area, and a very high percentage of African American lives in this area. And as a Black gay man that's living with HIV, you know, a lot of stigma is around not just HIV, but being of the LGBTQ community. So it's important for the community to see someone like themselves when they're not used to having an organization around like that. A lot of services that they have, some of them have been through, actually they would have to leave this rural area and go somewhere else. And for us to be here to provide these services for them to help them navigate through the healthcare system, and for them to see that there are people working in the community that look like us, and also possibly for them to have a chance to actually work themselves and be able to be a voice for themselves and advocate for themselves. So that's really why I think it's very important to have this community, especially when we're the only one around in the area at this time, and there hasn't been one before. And you're looking at an area that's about, well, we cover 5 counties, but it's about 9 or 10 counties in this rural area here. And the service is just not here. The education is not here like it should be. So it's very important to have this. We're glad to be here. And I think it's very important to have someone that looks like the community that is representing.
Most definitely, representation is a must. Gabriel, I know that your population is somewhat rural. Would you like to add to that question?
Yeah, I echo what all of my colleagues have said, and I think the additional kind of core competency that we have as community-based organizations is we're very nimble. I think when you think about the other types of institutions in the healthcare system, like the county health department, or even FQHCs, or large, mostly medical healthcare centers, they are often led and guided by very limited rules, parameters, laws. There's an extensive amount of bureaucracy, just to get a program or something implemented. And I think sort of the immediate response energy that we as community-based organizations bring to our work is that we are about being nimble, adaptive to our community and our clients, and that could even mean like mobilizing services, programs, or advocacy overnight. And you just don't see that kind of mobilization or nimbleness with other types of institutions. And I think when you talk about rural areas in particular, we also are very large. My geography is 27,000 square miles. So we're the largest HRSA jurisdiction in the United States, geographic HRSA jurisdiction in the United States. And I think the challenges that we face really require rapid and mobile responses. It requires very innovative approaches, and oftentimes community-based organizations are the prime ones to do that.
No, I definitely agree with you. From my years in the health department, I will always say CBOs are the gatekeepers to the community, right? It's normally the first point of entry that a lot of people encounter when they're entering into the HIV continuum. So going into a space and place that's welcoming, where someone at the desk look like you, right? That means a lot, right? And that has a really important and plays a really important role in getting people into care. Going into places that are affirming, that look like them, where they feel themselves like represented, right? So thank you for that. A lot of times in this conversation, particularly through this funding with Gilead and these new programming that we're developing at HRC, our theme or our tagline, not really a tagline, but really how we're moving forward in the work is, this is an opportunity for us to recenter and rewrite the HIV narrative, right? And doing that by focusing on communities of color, Black and Latinx communities. Here we are nearly 40 years into the HIV epidemic, and we see what populations are being disproportionately impacted, right? Black and brown folk. Why is that? Because I think early in the epidemic, oftentimes we were written out of the narrative, right? So I'm just going to throw this question at you. Like, why is it important that we recenter the HIV narrative on Black and brown people? It's that simple. Like that. I would love to hear your answers.
Would you want me to go first, JP?
Yeah, you
talking to me. Okay. Yeah. Well, I think, I even want to take the story. I want to begin the story even before HIV. And I think COVID-19 particularly has really, I don't want to say revealed, because we all knew it was there, but really emphasized and kind of brought to the light for the wider community the historical inequities and health disparities that have existed even before the 80s. And, institutionalized racism manifests itself in multiple aspects of healthcare and in multiple aspects of social and human services. And I think now we need to recenter the narrative, not just around how Black and Latinx people are experiencing HIV disparities, but really looking at mental health disparities, economic disparities, housing inequalities, and how does all of that play a role in furthering the HIV disparities today. So yeah, that's my thought, is really kind of looking at the full 360 of care and human dignity and quality of life.
Got you. Anyone else?
What we are seeing in this journal of the HIV, right, and the whole history of the HIV, you see for many years, some communities, they are not available to get access or get a chance to get those supports. And that's why it's the responsibility of us and bring those communities aboard. Example, in the Latinx community, you don't have too much information about HIV or PrEP or adherence or stigma in Spanish, and how you can say, o cómo vamos a mandar un mensaje cuando no se está hablando en el mismo idioma. How you can deliver a message when you don't speak the same language. And over here, of course, they say, oh, but we are in the United States. Of course, But I'm working in San Juan, Puerto Rico, what is a part of United States, where you have to send a message in Spanish because they are mostly population in Spanish. So I think we have to fix it, and we have to working together a responsibility if we want to end the HIV epidemic. That's why my efforts are as a grassroots organization and have those kind of connections with some such great organizations as HRC, Gilead, who was the support for my work for a long time, to get made this work down. And I think this is the only kind of work. So I think one of the problems or the issues is talking in the same language. Cultural competence for providers, right? For a transgender individual or person who they never, or immigrant, you have to have cultural competence in your agency to take care of clients. So that is the importance, I think, in my point of view.
Gotcha. Thank you for that.
And I just want to say, I think for this area, there's a lot of lack of education around HIV, lack of awareness around HIV, a lot of stigma, and just lack of just the knowledge itself. I've been back in this area for like 2.5 years, and when I came back, I was hearing a lot of HIV still exists. Is it still a problem? So that let me know then that there was a lack of awareness and lack of education around there. When, you know, in my first year, the second year I was here, I had a positivity rate of, I think about 3 or 4 individuals that I test, all Black gay men, well, except for one. You know, one day I tested 2 individuals, both was positive, one in the age of 20 and one in the age of 50. So, you know, the lack of education and everything around here, especially in the African-American community in this area, we need to get back to just, to me, simple, basic HIV 101 in this area, and bring some awareness. We need to get some, you know, billboards or whatever around this area, let people know that, you know, HIV is still around, and we still people still need to get tested.
No, and you make a great point there. So just to provide a little clarity for folks who may be new to this conversation, the Human Rights Campaign was awarded $3.2 million from Gilead Sciences. And that money spreads across pretty much all of our programming in many ways. It will fully fund our trans justice initiative, but then it also fully funds our HIV work. And in that, we're building out pillars of new work. One being a national public education, HIV public education campaign. The second is working with youth serving professionals around sex education and HIV. The third is working with our historically Black colleges and universities to make sure that those campuses have access to HIV prevention and care services for their faculty, staff, and their students. And then lastly, we're going to be developing an e-learning curriculum that folks can use that talks about kind of what you talked about, Cedric, as far as like providing HIV 101, right? For individuals, but then for organizations, as well as, you know, what is PrEP? And, you know, so we're excited about the development of that campaign, of that e-learning system. But one of the things that came out of it is we're making an intentional effort to work with minority-led and serving community-based organizations. And we're doing that through the development of our CBO Leadership Council, which is a collective of right now 6 community-based organizations, and all of your organizations being a part of that. One of the first things that we want to do, and we've met with all of you collectively to talk about, was kind of what you hit on the head, Cedric. You know, how do you develop messaging or get or have public education in your area for your folks? And through that, we're helping each organization to develop a localized public education campaign, a HIV public education campaign. So I asked this question: how will the development of that campaign and this partnership like address the needs of like your clients? And well, first I start with, what are the direct needs of your clients and how will this partnership help to address those needs? We can start with Arianna. You're on mute, Arianna.
I'm sorry. Yeah. Well, I am so happy for this question because I think it's so important to, when you partner with grassroots organizations, partner with a grassroots organization who they are really prepared to make you to make that job done, right? And as my organization in Florida, we are expertise in collecting information and data. We make 3 or more community need assessments in South Florida, and we just finished one in Puerto Rico, what is historical in Puerto Rico. Was a partner with University of Puerto Rico, and University of Puerto Rico just asked for 100 questions, for 100 answers, and we collected more of 300 answers of those kind of answers from transgender women living in Puerto Rico and make the assessment. So we have the numbers, we have the leadership, we have the grassroots organizations, and also we have a great team with HRC and with Gilead to make this kind of campaigns come through and come real. Like tell you, 63% of the transgender people in Puerto Rico think Puerto Rico is a no safe place for a transgender individual to get healthcare, what is including HIV services. So I think with those kind of types of information, we can create a stronger campaign who they touch and educate the population, what is the key to get access to care or get access to PrEP. What is in vulnerable communities, they don't know nothing about PrEP. You can ask to a gay man what is PrEP and they give you information, but you can ask to some person in the supermarket or a Uber driver or a transgender about PrEP, and maybe they don't have the correct information. So I think this kind of work is going to work very beneficial for the most marginalized community and partners. In Florida, we need housing, we need a lot of the stigma, you know. Fort Lauderdale, Miami and Fort Lauderdale, they are still in the first and the second place in new HIV diagnostics. So I think and nationwide, so it's important to focus in the South and to working for ending the epidemic.
No, thank you for that. And one of the points that I took away from that, you hit the nail on the head, is that when we're developing like our HIV public education and awareness campaigns, that a lot of times we tend to focus just on like our priority population when there are other folks in the community who actually need and can benefit from that messaging as well, right? So I think that's something that like we would definitely keep in mind and have to keep in mind when we're working together to build out like these public education campaigns. Gabriel, I pose the same question to you. Like, what are the needs of your community? And you know, how will we like address those needs through partnership?
Yeah, so my organization is one of 6 CBOs in Riverside, San Bernardino County, or Riverside specifically, actually. That's a COVID response organization. And we were funded specifically to do, I don't want to say COVID work because we're working specifically with people living with HIV, but it is to help them reduce their risk of COVID, but also handle case management and linkage and treatment adherence to their HIV services. And, you know, that's a very difficult proposition right now. I think for direct service providers, there's a unique thing that is occurring, not just with being in sort of this telehealth environment, but what does it mean to do telehealth in a telework environment? And that's very different. I mean, if you have a one-stop facility, you have your brick and mortar and your 4 walls, that's one type of challenge in implementing telehealth services. But when your entire staff is scattered at home, maybe intermittently coming in the office, don't have access to consistent technology, how do you deliver and, you know, do outreach and deliver services for telehealth in a telework environment. And so, that is a real conundrum for us, particularly with being in such a large geography. And so one of the things that we're doing is we're really trying to dive deep into technology. We're really trying to look at things like, billboards and text-based, dial to 41114 and you get a link. And, and I think that's a little different than what a lot of us CBOs know how to do. I've never done that before. We've never done billboards or bus ads or PSAs at any large scale before. We don't have film studios and productions, to produce, all these high level media assets for, widespread community distribution. And so I think one of the things that I really hope, and, I'm gonna hold you to task on this help with as CBOs. I was over here thinking to myself, I have a laundry list for HRC of technical assistance I need now. But, we really are going to help leverage this partnership to be able to design these innovative messaging and to kind of, make something that's, I want to find the right word, that's cool and sexy. You know what I mean? Like, our graphics designers and, the local designers, sometimes, it's on a piece of paper and it's just printed up from the computer. That's how we start off as CBOs. Like, that's just where we are. But if you're talking about doing widespread community messaging as a vital organization, we really need to have an added layer of sophistication and polishedness to our media and our messaging campaign. And I can say for TruEvolution, that may not be our core competency. And so I really am looking forward to this messaging campaign, particularly how we can better polish our communications and how do we do targeted ads so that we target the certain zip codes in our community, and how do we do the Facebook targeted ads? I think all of that is such a new frontier for us, and I look forward to HRC assisting in those areas.
And you know what, that excites me the most about like this partnership is the fact that we're able to bring like and leverage what HRC does so well, right? Which is like messaging, right? When we think about the Equality Act, when we think about marriage equality, we have to think about like how effective HRC was in moving that and moving those needles and those policies and that legislation. It was through messaging, right? So yeah. For me, like this is an exciting opportunity for us to kind of leverage like our in-house studio production, our video capability, our ability to like help with CBO brand refresh, like those types of things. So that part makes me very, very excited. And we look forward to working with all these organizations because we understand that like without exposure and messaging, we can't really like talk about access, right? So we're excited about this partnership. Cedric, I still pose the same question to you as well.
Well, I agree with both Gabriel and Arianna. Being in a rural area and then being a new organization, we just don't have that resources basically to do a lot of the the billboards, the social media, and I'm a much older person, and my social media is just like a good thing I got some young people here. But one other thing that I also think we need is, well, for my area, is basically some training for advocates, and some programs to build our advocates up. We have some in the community that's ready to step.
You went on mute.
Yeah, I pushed it by mistake, but we have some in the area that's ready to step up, but we just don't have the resources. For years, everything has been going to the Jackson metropolitan area, and the rural areas have just been left out. So training for our advocates, I think we need to start getting to our local officials, not just state and national officials, but our local officials as well, working on some of the policies in our small towns and small areas in the county, and that will actually come from, training advocates, getting some strong advocates to help do the work.
And when you talk about like advocates and training advocates, that's another part of like this partnership, right? We're developing a program that focuses on like our Generation Z, and like how do you utilize storytelling to like mobilize the community? Like, how do you use storytelling to like push policy forward, right? How do you use storytelling to like bring resources and services to your area, to your population? So I think, so with us, like in this partnership, there'll be a lot of opportunity and work for us to do some work together as CBOs, as it relates, CBOs with HRC, as it relates to providing some development and training and like bringing that storytelling aspect of to our youth advocates. What are like the major challenges in like give me like some successes and challenges of being a minority led in CBO in your area, like present day?
I'll start.
Oh, go ahead.
I'm sorry. I'll start. Well, with the successes, as you know, I'm from. This is my home area of Mississippi, and I've been here like 2.5 months. Like I said, the success is that people have started welcoming the information. They start welcoming the testing events that we had because there were none, and when we did community events or community presentations, a lot of people didn't know some of the simple things about HIV, and so that's been good for us. The challenge is that the population that we mostly try to reach is there's no place for them to actually frequent. In other words, there's no gay bar or anything or gay club around in this area. We have to use social media to gather that. And then we have a lot of, especially young Black men who really not out in a sense. And it's hard to reach that population as well. So that's one of our challenges. And surprisingly, well, not too surprisingly, most of the churches in the area actually, welcome us and in the work that we do. Another challenge is getting to the schools. We're unable to get into the schools, the high schools, because of a law that Mississippi have. Basically, you either do abstinence only or abstinence plus, and you cannot demonstrate how to use a condom. You can talk about it, but you can't demonstrate it at all. So that's a big challenge, getting into the schools. And we know that the young people in the school are having sex. So you just can't get in there to just even do simple sex education, real sex education, not the watered down stuff.
Which is why, again, through this partnership, we've been very intentional working with those youth serving organizations and professionals. Because like, if we know that they can't receive this information in their schools, where are places that they're going, who are youth serving professionals that they engage and interact with, be it, the YMCA or the Boys and Girls Club as an example, right? So like, making sure that we're being intentional and like engaging those folks into the conversation, and that they have the training that they need so that they're able to provide that level of education to young folks, in the end goal to help mitigate like mitigate incidents of like HIV acquisition, right? Gabriel, I'll ask you that question as well, like your lessons learned, some challenges.
Well, the last 18 months to 2 years has certainly been a very different experience as a minority CBO than the first 10 years. TruEvolution is celebrating 13 years this year. And so, thank you. Yeah. And it's interesting because it really was like the first 7 to 8 years, our region fell into this weird place of being in California. So funders and government thought, they're not the Deep South, it's California, expanded Medicaid, it's all roses and feathers, everything is well. But then the reality in California is that we are so large and things are really implemented at the county level that what is happening in our community was devastating. And some of our rates, particularly around poverty, around crime, around unemployment, is really some of the highest in the country. As well, when you look at other kinds of disparities outside of HIV, and those are what exacerbate HIV disparities. And so, when you're trying to fundraise, you're trying to generate revenue, you're trying to, create services and programs, and it costs money, it costs resources, If you can't get into the schools, like Cedric says, how do you go about creating your entire own curriculum or your own HIV school? Well, that costs resources. And so I definitely have seen that over the last year to 18 months, there has really been a reprioritization and a greater visibility of my region. And in the state of California, a lot of RFPs that come out from the state of California now say that you have to partner with the CBO in a under-resourced, is what they refer to it as, under-resourced county. And I think the ending of the HIV epidemic with the 48 county jurisdictions and territories really helped, because it allowed San Bernardino and Riverside to be listed on a national federal list in a way that it had never been listed before. I would say one of the challenges that still exists today, though, is that a lot of times CBOs, particularly when there is a scarcity, there's not a lot of us, or you're one of the only ones in the region, a lot of times community thinks that you are the everything. You are the catch-all. Send everyone to Cedric. Send everyone to Arianna. Arianna can do it all. What are they, trans? Go over there. Or if they're trans, send them all to Arianna. And it's like, we don't have a workforce development, mental health program, all the legal services, transportation services. There's limitations to what we can do, and there's often an expectation of us to produce constantly, and to always be operating at top tier. And I think there isn't enough resources still for any CBO around the country that is getting sufficient enough dollars to be the everything for their community. And that is still kind of a challenge that we find ourselves in, and expectations that are put upon us by, community, but also by our funders.
And I think that expectation comes from community, because there aren't places that people in community can really go, right? And feel safe and welcome and affirmed. But I get what you're saying. It causes a burden to your system and your ability to really provide services. It's like, if we don't have the capacity to do that, then we don't have the capacity. And capacity means we need the money to be able, the resources to be able to do it.
And a lot of times, CBOs, I notice that we sometimes shy away from that. And, we kind of always want to be about soldier missionaries doing the work, shaking the tin can, just hitting the pavement. And that's absolutely who we are. But in this day and age, and in this world, running a nonprofit organization is running a business. It is a business, straight, period. And we pay other kinds of taxes. We pay payroll taxes. We have to increase cost of living, minimum wage. Our funders giving us funding to keep up with the minimum wages in our states, is the amount that you are allowing us to pay our staff, and the fringe benefits rate that you're allowing us to give our staff, is that keeping up with the other laws that we have to follow, of labor laws? We have to follow labor laws, and it costs money to adhere to labor laws often. And so are people factoring all of those business nuances in when it comes to supporting CBOs?
It's like, it's great to have a passion to do the work, but you also have to have a business mindset to be able to do the work effectively, right? That's and there's a difference there. So, and you all are prime examples of effectiveness and passion, because you have to have both. You can't do it. The model does not work with one on just the or the other. You have to have the both. Arianna,
and that is the same message. Many of the agencies and foundations, they have to know all the transgender activists doing the work. And they have to know who the person talking about transgender community have to representing and have to have number behind, because many they're asking, but they're not doing the real work. Like people, they said dirty work. I don't think it's dirty work, because the lesson, what I know about here is, as an immigrant, as a person who coming from a far country, that is true. If you come into United States, you working hard, you doing your work as the law say, you create talents and make your talents work and make difference in United States, you can create a quality of life in United States, no matter who you are. And that is my example. As person who they coming to work for transgender community, transgender agencies, or any person who they want to work with transgender community in South Florida, Puerto Rico, they have to contact me. They contact me because we are the first resources, and that is a very, very, I feel glad for that, because sometimes it's a passion for the work. That is the most mood who they empower to us to work, empower passion to work. Because for one side, we ask for resources, we are for financial, we working for $5,000-$10,000 to working, but the grassroots population, they don't know. They think we received the $2 million from Gilead. They receive we have the whole grant or the whole money for transgender, and that's true. When they need something, the first person contact is Arianna, and that is terrible. And as an activist, as I'm doing the work, because I'm in the middle, and my mental health sometimes is so stressing, because I have to work, I have to prove the work to foundations and agencies and partner for little or for something, but also working with my community and don't make that trust they have on me broke, right? So I have to all the time working, and that is what I think the most difficult is resources and support the work for trans-led organizations.
And what you just said there is like really the definition of like how I start this conversation, as CBOs being like the gatekeepers, right? And these points of entry into care, not just for like, our clients, but also for like, funders. And when people want to expand and do work in the community, you can't do the work if you're not fully, if someone's intentional about funding or addressing HIV or eradicating HIV in any population, you have to go to the community-based organizations who are on the ground doing the work, who have their finger on the pulse of the community, which is why we're so excited to have all of you on board. Yes, just so excited. But for me, it's hitting home that notion that like you have to invest in your community-based organizations. So one thing I just want to ask you, I know everyone's been thrown a curveball. Gabriel kind of talked about it briefly. He's leading in many ways. He's being very humble. He's leading like the state's like COVID like response in some ways in his area. So like how has COVID, or what impact has COVID had on your ability to, one, deliver services to communities that are, most marginalized and in need? And, like how has COVID really like played into that? And what have you done to address like, not being able to come to the office all the time and all that, stuff that comes along with like this isolation?
Well, I can answer.
Yeah.
For me, I'm from the South. You can see the difference. COVID was very difficult for us. Even as right now, any of my team is not set up for vaccination for COVID, and we partner and we have to go and make outreach to vulnerable communities, people in risk, people. So that is one of the access to vaccine or access to just simple HIV COVID testing. Transgender community don't have the opportunity in the South. What is totally different in other parts. I see my colleagues from Trans-Latina Coalition in Los Angeles, all they have a vaccination because they doing group. And so that is the difference how they working over there and over here. We are still trying to find resources or find ways to get access to continue provide the services. But example, not just there, but in social services like name change. Right now, the course, everything is online. And if you are not a legal attorney, you cannot submit a name change petition now, or you cannot claim name change petition in the counties because you have to have the access to a lawyer have to the papers to fill it out in the court.
Right.
So as a grassroots organization, I don't have that ability because for me was go to the court, order buy the packet, fill it out with the client, and submit at the court. And now we cannot do. So we have to re-structure and redoing the services. But COVID was impacting a lot in the and the work what we're doing. Everything virtual, you know, as for PrEP or for HIV care right now, the telemed,
yep.
Telemed. Many transgenders, they don't have access to Wi-Fi to have a telemed.
Right.
You know, or they don't have available cell phone to just have a camera to make a telemed. So this kind of resource, this kind of scenarios we have when we are going to take care clients for immigrants who they release detention center and they don't have any paper, they cannot work. We have to find support to people they can connect in. So it's more difficult in the South for me. I'm doing the work.
Thank you for highlighting it, Arianna. Cedric.
Well, for us, COVID, we had to go more technical in a sense. We had to do more virtual stuff, which kind of created a problem because being in a rural area, certain areas you won't get connection. So we did lose some of our participants, and speaking with them, they all missed the in-person activities that we were doing, where we were able to kind of, in a sense, fellowship with each other. We would always have food whenever we have a program that we did. But a lot of people couldn't get online or didn't know how to get online because we served both young and older people living with HIV, men living with HIV. And for the older one, it was kind of difficult, or they didn't have the AT&T phone or something. It's probably a local phone that they had. So that was a problem for us. But what we did is basically, you know, try to assist in the virtual stuff with them. If they didn't have a area where a phone or something, we try to do what we could to make sure they would get online. And we started giving food gift cards to those that participate, you know, because, you know, here in the South, in Mississippi South, you know, food is very important for people and going to basically want that. It was kind of difficult for us because during the time of the COVID, this is when we were getting started. Our official day of being apart from the organization that incubated us, a service coalition out of Hattiesburg, was October the 1st. So we were on our own. We had to, you know, thank God for the resources we had. We had to get more technology-based stuff to continue doing what we're doing. And in our peer navigational program, it was kind of difficult to actually just go pick someone up and take them where they needed to go, especially during that time where a lot of the clinics was actually closing or wouldn't allow people to go inside. They had to stay outside and get their services. So, but, you know, we've managed, we think things are getting better. I'm hoping by this summer, we're able to see people face to face because that's what our participants are telling us. They can't wait till we get together because they missed that.
The face-to-face interaction is everything for folks.
Yeah.
And Gabriel.
I mean, I have to just give a shout out to Riverside County, specifically Department of Public Health, the Housing Authority, and the Workforce Solutions Department. And they did something very unique that not really many counties in California did. And they chose to use their CARES Act monies to subsidize and build infrastructure within community-based organizations. That's what they did. Most of the counties did sort of this rapid response where they just kind of kept everything within their counties. They kind of scaled up their own internal operations. They're like, okay, we do it best, so we're just gonna do it and use the money to increase our own operations. And Riverside County actually had a very different approach. And I know it was a little controversial, but it ended up being a very brilliant move. And that was to use their CARES Act dollars to subcontract CBOs. And, you know, when my agency was asked to, first off, be a provider under the state of California's Project Room Key initiative, which is our statewide emergency housing protocol for people who are homeless during COVID-19. And that was one of the mandates that the governor's stay-at-home order triggered, is that it required every county to house their entire homeless population. Now, you know that it's nearly an impossible feat in one of the, you know, largest states, and it's really an impossible feat for any state, you know, really, to house your entire homeless population. And that's really an indictment on the system.
To Gavin Newsom for like making that a priority, to make sure that.
Yeah, you know, it's interesting because when you're talking about elected officials, it's like one moment you're like, love this, then you're like, oh, but wait, do this, do this, do this. But, you know, to set anything aside where, you know, I may have done certain things differently. I mean, I'm not the governor, but, you know, I may have wanted to see certain kinds of approaches. I think the one approach that I really, really thought was trailblazing is the way the state and our local county, Riverside County, is choosing to invest in community-based organizations. Mm-hmm. They're choosing to put health equity in the framework of their program implementation, addressing racial justice issues in the core of their strategy. And I know that's going to look different from county to county to county. Not every county is going to agree with my, you know, statements on what's happening in the state of California. But in Riverside County, how that's being implemented in our local county is something that I am seeing as a success. And I appreciate your comment on our organization leading the way, because I want to receive that, but I also want to expand that and say that there is a cohort of CBOs that are all doing the work, and we all sort of rose up around April of last year, and the county formed a lot of us together to try and be a sort of community-based rapid response contingent. And so many organizations, so many CBOs in our county are literally the trailblazers. Like the CBOs are the trailblazers in Riverside County. It's, you know, all of our institutions and the healthcare systems. I mean, obviously they're doing the medicalization portion significantly. When you talk about case management, linkage, contact tracing, testing, continuity of existing HIV services, mental health, support groups, food distribution, these are CBOs. Right. Grassroots CBOs. Right. And I hope that other counties look at counties like Riverside and use that as a model for how you should be investing in your nonprofit infrastructure, particularly because CARES Act money has ended, rescue package on its way, on its way. When it gets here, that will be over too, right? Mm-hmm. That will sunset. So what are you leaving behind, county, state? What are you leaving behind within your CBO infrastructure that's going to last beyond COVID-19? Right. So for us, you know, investing in IT infrastructure, telecommunications, building up our systems, like that was essential, not just for COVID, not just for last year. We have needed this infrastructure for a long time. Exactly. And this is going to be something that's going to last us beyond COVID-19. My IT ain't going nowhere. The computers ain't going nowhere. You know, the new fiber optics that we put in to make internet actually so that we can actually stream. We couldn't stream, you know? And so, you know, I'll stop there, but I really am passionate about what counties do right now with their COVID money, and places like in Arianna's case and Cedric's case, you know, they could be beneficiaries of large increments of COVID-19 funding. They could be beneficiaries of it. And we need to push our counties to do that more.
I had a conversation with a couple of EDs from CBOs, and I said to them, your job right now is to figure out how to use this COVID funding to make sure for sustainability, organizational sustainability, right? Because once this funding goes away, how will your organization function? Because it's going to have to function in a new world. Because this is not going to be the same world, you know, that we were used to a year or 2 years ago. This is a whole new landscape. And COVID has kind of like taken the mask off of, like, you know, funding and organizational structures and all that good stuff that we for a long time did not really talk about. So I stress that point, and I think you hit the nail on the head. And you're a prime example of like what it looks like to actually use this opportunity to invest in your organization for the long term, to make sure that you're able to provide these services long term for your community. As we wrap up, I have this one, give this one opportunity for, I think we're going to have a ton of eyes on us today who are watching this broadcast. One thing, like, what is one thing that you would want, your closing remark, what is one thing that you would want to leave with folks who are watching today who may not have any knowledge of community-based organizations or HIV or the work that you do? What words would you leave them with today? Starting with Arianna.
Well, I just want to live with the words opportunity. As a trans-led organization, as representing as many trans-led, trans activists around the United States, many activists in social justice, many activists in HIV, we need opportunity. We not just give opportunity at the table, but we give opportunity to have better quality of life. For me, I am very proud to be a CEO of my organization, but just to be a CEO was not easy. And many people, they don't see me as a CEO, just see me as a transgender or as a person who they can help in the world. So I think give it the opportunity, because you don't know who opportunity you give. Maybe they have a bright talents to make impact in the community and don't and helping a lot. So I think for the transgender community and everything is opportunity, because we are resilient and we are unstoppable.
And we love the work you do, Arianna. Thank you.
Thank you so much.
Cedric.
I would say support, and these organizations, especially minority-led organizations in your area, learn more about what's going on, learn more about them, and just give as much support as possible. And whatever support you can give, whether it be financial or whether it be volunteering, just support these organizations, and in the hope that more minority-led organizations get started across this country, and especially in rural areas.
Gabriel.
CBOs aren't just institutions, but they are made of people. And I think often I see my colleagues around the country who are not supported individually as leaders. So, I mean, first of all, Arianna's comment was just the kind of, for me, it was the post-it note of the conversation, what she just said. But then I think about Arianna, and then I think about Cedric, and then I think about them as individuals and what they have to go through. And are we making sure their healthcare is okay? Are we making sure their bills are paid? Are we making sure that they have the ability to do their work and all of us to do our work? And so funders, don't forget, we are not just two-dimensional institutions. We're people, and we are living with HIV ourselves. And you need to ensure that you are investing in all my brothers, sisters, siblings that are doing this work as well, and not just the organization itself, but the people within it.
Thank you for that. I don't think that could have been said any more poignantly or beautifully. Thank you. I want to thank you all for being a part of this dynamic conversation today. As you all know, I'm excited about our partnership and look forward to the great work that we're going to do together, right? To curb HIV in our communities, essentially eradicate HIV in our communities. And I just want you to know that, I am fully vested in, and as you already know, in community-based organizations. And when I say that, particularly those that are minority-led and serving. So I just wanted to end on that note. I will end on one extra note for those who are able to have access or gain access to the COVID vaccination. I encourage you to speak with your family and your tribe and your medical professionals. I understand that there's a lot of medical mistrust in our community, not just from generations or decades ago, but from months ago. However, I would ask you to actually take a look at actually taking the COVID vaccine. Speak with your medical professionals, speak with your friends and your family. And I will leave on that note. Thank you all, and have a great day, and look forward to working with you all.